I'm Shay Pausa, and this is ChiKii, Woman to Woman. By now, I hope you've heard about inflammatory breast cancer, or IBC. Knowing about it can save your life. It accounts for less than 6% of all cases of breast cancer, and yet is responsible for more than 25% of all breast cancer-related deaths. Today, we have a story of celebration. 7 women who have survived IBC. Thank you so much for being with us today. And we're going to talk with each of you to tell us a little bit about your stories. But Sarah, if I could start with you, what makes IBC different from what we think of around breast cancer?
The first thing that we like to share is that you don't have to have a lump to have IBC. It lays down in the lymphatic system of the breast. It's part of the lymph nodes that we all know we have. So from the time it lays down its first cell, it has access to our whole body.
Oh my goodness.
And that's why we have chemotherapy first prior to our mastectomies.
MP, we talked earlier, and you said about the ages when women are diagnosed with this.
The younger you are when you're diagnosed with IBC, the more invasive it is into your body system, and the less likely you are to survive. And we would have liked to have brought a young person with us today, but unfortunately the young women that we've known so far have not survived the 5-year mark. And it's incredibly invasive, and it's very important that if your doctor doesn't know about it, you ask.
And Jacqueline, you said you had sort of an unusual symptom. Can you tell our audience about that?
Yes, I noticed when I looked at the breast that there looked like little indentations that were all along the area where the cancer was. They look like little ingrown hair follicles, like little, and they call that pierre d'âge. There was a slight redness to my breast, a hardness to the breast. The breast had expanded and gotten bigger, and then there was these little marks that were all underneath where the area of the cancer was.
Sort of looks like an orange peel.
Now, you were a younger woman when you found this. You were just how old when you
47, and this was back in 1983. So I'm a 23-year survivor of inflammatory breast cancer.
Right.
And at that time, I was the only one I knew that had inflammatory breast cancer. A couple years later, one of the doctors asked me if I had had any problems with numbness or neuritis in my feet or my hands, and I said yes. And he told me that one of his patients was really having problems with the pain of it. And then about another year later, I had another woman call me asking about inflammatory breast cancer. She lived in Sedona and was coming down here to Phoenix for her treatments. But beyond that, that was the only persons I ever heard of having inflammatory breast cancer.
Now, if a woman is doing her annual mammogram or doing her exams, is she going to catch this?
Probably not. It doesn't, it very rarely would show up on a mammogram. As a matter of fact, I was fully involved with my breast, with inflammatory breast cancer, and it did not show up on my mammogram. They then had to do another test in order to verify that there was something going on because it was visible to the eye. So you could have a mammogram today, and next week wake up and your breast could be warm and red and hot, and you could be by then fully involved with cancer, and you would have missed it a week before.
Mammograms are a diagnostic tool, but they aren't always positive. I mean, you can have a mammogram and it can be negative, and you can have cancer, and you can have a positive one and have a biopsy and there's no cancer there. So it is not an absolute positive thing. It is a tool for diagnosis.
Yeah, I'd like to add that it is not usually a diagnosis that comes from a mammogram. It is a clinical diagnosis, that there is a visual symptom that the doctor picks up. And that's what we're hoping to encourage, that we're educating people and doctors so that they are looking for these symptoms. A mammogram is looking for a tumor or an abnormality, where the IBC is, it can be an inverted nipple, it could be a rash, it could be a swollen, a lot of people experience an itch or something, so it is not concerned with a lump or a mass?
My IBC was diagnosed, I think, by my primary care physician. I credit him with really saving my life. I had the red rash and feverish feeling and pain, and when I went into the doctor the first time, he wasn't there, so I saw his assistant, who put me on a round of antibiotics. And then I went back in and I saw my primary care physician in about 2 weeks. He immediately knew what it was. That was a Friday afternoon. I was in for a biopsy on Monday and in to see my surgeon that same afternoon.
I had a breast biopsy about 12 years prior to this, and I had noticed the scar had started to indent. And so I was thinking, well, that must be scar tissue, you know, just trying to think of everything that could cause this scar tissue. And so I just kept watching it, and then noticed it started getting red around it. And then went in to see the breast specialist. But we were all lucky and diagnosed right away. And some people, they know there's something wrong, but the doctors are saying, we can't find anything, everything's fine, don't worry. So you kind of have to stay with it, with your feeling. And
We invited all of you here today because we wanted people to see that this can happen to anyone and that it is happening to more people than we might expect. But I think this is yet another example of how taking charge of your own health can in fact save your life, and it is important that you're paying attention. Thank you all for being here. I'm Shay Pausa. This is ChiKii Woman to Woman. Join us again as we meet real women telling their stories of inspiration, challenges overcome, and lessons learned.